If your patient has incompressible arteries or an ABI greater than 1.4, the TBI exam can be used to further examine limb perfusion. This condition can occur in patients with diabetes. The TBI exam is used to determine the toe brachial index. Begin by selecting the TBI exam from the File menu. Wrap the arm cuff as was done in the ABI section. Place a small digit cuff on the great toe and the PPG sensor distal to the cuff. You must be able to get a PPG pulse in order to obtain a toe pressure. You can obtain a toe pressure with a Doppler, but it is more difficult as the digit arterial signal is not easy to obtain. Fill in patient information, current symptoms, risk factors, ICD codes, etc. on the report. Use the computer cursor and click on right brachial site. Place the Doppler probe at an angle to the skin over the radial artery. Move the probe slowly back and forth until the strongest arterial signal is heard. Press and hold Inflate on the cufflink remote and inflate the cuff until you no longer hear the signal, and continue for an additional 20 millimeters. Release the inflate button and the cuff will automatically start to slowly deflate. When you hear the Doppler signal return, press the pressure button and the pressure will be stored in the right brachial field. If you want to repeat the pressure, just repeat the process and the new pressure will replace the previous one. When satisfied, press Next on the remote and the system will move to the right toe. While listening to the beeps from the PPG probe, press and release the inflate button on the remote. It will then automatically begin to deflate. Press the pressure button when the beep returns and the pressure will be stored in the right toe field. To obtain a PVR waveform, press the button with the waveform image on it on the remote. The cuff will inflate to the proper pressure and hold that while the waveform is obtained. Press Next to move to the left brachial field. Repeat the previous steps for the left side to obtain pressures and waveforms. When finished, save the report.